Hello everyone, welcome to another one of my Care and Mind videos where I usually talk about mental health, especially from a carer's perspective. Quite a few of my videos are on how carers try to deal with caring for someone who is suffering from mental illness. And just as a reminder, when I say carers, I don't mean care workers, I mean just ordinary carers in families, friends or neighbours. And this video is going to be slightly different, and I've got to apologise, I have a bit of a sore throat, so I hope you can hear me clearly. I'm going to try and be fairly quick because this video is going to be fairly long, because this is one of the first of the series of mental health systems around the world. Now, I've been perhaps doing a bit of research for some months now regarding what are the mental systems are like in certain countries, and I think we're trying to cover at least over probably 28 countries, and not spend too long on them because the video will be just too exhaustive. I want to mainly just look at the challenges each country has regarding developing and focusing on mental health issues and on their mental health policies and systems. It's not, as of present, as of 2017, it's not really a pretty picture. Now, each country, I suppose, is usually given a model. I suppose that they work off the World Health Organization or their own policies. And usually, there's been a push for a lot of deinstitutionalization, in some sense, to not have mental health patients be locked away in the hospital. Hence the push for care in the community, because it can lead to abuses, human rights issues, basically quality of life, if you could call it a life, seriously diminishes. We'll also be having a quick focus on each country's ranking in the World Health Organization suicide list. So where do we start? What I want to do is focus first. It's not in alphabetical order, but I'll put in a country in a list, and the first thing I want to perhaps focus on is, I suppose, China. I think I'm going to put it in ranking of largest population to smaller. So China, obviously, for population of 1.3 billion. I've been looking at China's mental health system for some time. I remember on the suicide ranking list, they were, I suppose, in the top 10 in 2017. There's been a massive decline where it's now, the ranking's 115. Don't ask me how. As far as I know, it's been told the reasons for the large drop in suicide is that there's been a big push to have the community, the population, living in urban areas in the city rather than rural communities where there's obviously lack of support, access to agricultural harmful medicines. And there's also a cultural issue as well, why there was a big push for those committing suicide. In fact, I suppose China ranks as one of the countries where the ratio of female suicide is actually higher than the male, and this does rank down to cultural beliefs. But I must put a warning on this one, because getting the data from how suicides are in the ranking is, I suppose, very difficult, and there's still, unfortunately, human rights abuses in that country. So there's a long way to go, but let's have a quick look at the mental health system. Basically, the vast majority of health professionals in China are psychiatrists and psychiatric nurses, but there are very few, unfortunately, clinical psychologists and social workers, which is a very big problem. And another fact is there's hardly any occupational therapists. So it's not only is thin on the ground there, that means a lot of research is needed, a lot of training is needed, because there's still a lack of those important roles. It's also evident that there's unfortunately, the ratio regarding sharing in the wealth, you have obviously the highest mental health care needs are amongst the poorest. To compound the issue in China regarding the mental health system is the lack of relevant laws and regulation. Involuntary admission is usually undertaken under the name caring about mentally ill. That means, unfortunately, there is a high rate of involuntary admissions. Also, unfortunately, and I will be just stating the challenges for each country regarding the mental health systems. A few of them actually have, I will point out in other countries successes. There are a few successes. Another challenge China has is, unfortunately, that there are fewer medical graduates who are willing to be trained as psychiatrists. You also have to consider that a lot of the psychiatric hospitals in China are losing a lot of professionals with higher levels of education and training. They're going elsewhere, if I could just put it that way. And one last look is, and this is not really a challenge, this is just pointing out that depression and anxiety are the most common mental health problems among working age adults, but a very big important issue that I've got to mention in regards to China. And they are also suffering this ticking time bomb that you'd have currently over in Japan with the population growing older. And you've got to admit, this is the largest population on Earth. They've got a dementia problem that is growing. And this is going to be, it's got to be one of the biggest focus in China. What are you going to do when you just don't have an adequate mental health system and your population is getting older and your young workforce is beginning to drain? So, okay, the next one I want to look at in regards to population is going to be India. I think they have around about 1.3 billion in their population. The ranking on the World's Health Organization suicide list is 24 compared to China, which I think was around 115, 112. It's fairly high. I'm not sure how accurate that ranking is. And I had a look at this, and most of it, actually, a high percentage of that seems to be down to what you call family problems in regards to why so many are committing suicide. And obviously, there are other issues as well. Looking around, I've noticed, especially on the internet, and I've read quite a few news articles regarding India's mental health system, there's been a current media backlash on India's mental health system. There's been a lot of scandals. Now, according to a report, I'll point out one report from Human Rights Watch. They had visited 24 hospitals in India, and one of the big problems, again, which I mentioned also in China, was the high rate of involuntary admissions. You also got overcrowding problems, forced treatment, hygiene issues, and worst of all, considering to me anyways, a lack of empathy within staff, within the hospitals. You just don't seem to have the empathy when they're treating patients. Now, India, I think there's only about 43 government hospitals, which unfortunately relies too much on the institutional model rather than the community one. Remember what I've said at the start of this video, is that there's a big push for deinstitutionalization. Hence, you want to have those suffering, obviously when they've come very ill, yes, they need to be in the hospital, they need to be in a secure place, but you don't want to keep them in there forever. So there's got to be a push where they're out in the community. Obviously, you've got a higher quality of life as long as the models and resources are there, which I will come to point out when it comes to other countries that I'm going to be looking at. Now, going back to India, there's around about, I think it's about 3,000 500 psychiatrists and I think 1,600 psychiatric nurses. But you've got another problem in India regarding the state of the mental health system. The problem is stigma Stigma in the community needs to be tackled. There's a high rate of stigma, which probably explains why there's a high ranking within the suicide ranking list from the World Health Organization focusing on India. Another problem is that another challenge for India is that mental health isn't really covered under health insurance. So yeah, people have to pay for their own costs. But there is more surveys being done. A 30-month national surveys, I think, it's just been finished. And again, with more surveys being done, more data that needs to be collected, it can only really put pressure on the government to come up with sound mental health policies. Another thing to note, again, not really challenge, just pointing out that the most common problems regarding mental health in India is usually depression, anxiety disorders, and substance abuse. There are others, but these are ones that I've noticed. And one thing I want to make clear, I should have mentioned this at the start of the video, is that this is very, very brief regarding each of the countries' mental health systems and their challenges. So I'm not an expert on this. I'm just pointing this out. This is very basic information. If you want expert opinion, please trawl around, look at the World Health Organization sites, read reviews, things like that. Ask expert opinion, just basically a carer. This is something that I found interesting before. I just want to point out. So, okay, next population, which is rather large. And again, this is the United States. Now, the population, I think, from the United States, around about 330 million. On the World Health Organization suicide ranking, they rank around about 48, 50, which is, I think, it's actually quite fairly high for a Western country. Considering, we've got to make note, considering how much inroads the states have made through the area of psychiatry, and this could be down to, there's no doubt about it, with Obamacare and President Trump trying to tackle the United States complex health system. There's a high rate of suicides this time, which is probably the norm with a lot of the countries I'm going to cover, but over in the States, the high rates of suicide by men is 3 times higher than women. However, the US spends around about, I think, over 100 billion on mental health treatment, but this is another problem. There's a higher rate on drug prescription, on spending, and that does indicate, sorry, it's my throat, does indicate that there's a pharmaceutical dominance in that country, and I think that definitely needs to change. Mental health care is, again, we're looking at the money issue, is very pricey in the States, and I do feel the model is very business orientated. Another weird situation is, despite the US having a huge media influence regarding mental health, the stigma towards mental health is very high, as many do not understand much about mental health, refusing to actually seek treatment. And there's also, and this is common between quite a lot of countries I'm going to draw through, there's also a lack of beds, and the US also has a lack of mental health professionals. Another interesting thing, actually, with the lack of mental health professionals, I think the state of Vermont has the best access regarding mental health treatment, but Mississippi and the state of Alabama having the worst. Notice they're in the south of the states. Access to health insurance has increased, but the challenge to the health bill, and I did mention this before, has caused more concern. So the next country with a fairly large population, I suppose we'll look at Indonesia, and I think their population's around about 270 million. A very low ranking in the World Health Organization suicide list. We're looking at 170. But unfortunately, and as I said, I will look at the challenges. Unfortunately, people with psychosocial disabilities in India that are often shackled or forced into institutions. Now, I remember actually attending one of the events, I think over at the Medicine and Hygiene, Tropical Medicine and Hygiene Institute in London, and they did talk about this practice called Pasong, Actually, yeah, it was the Institute of Hygiene and Tropical Medicine, and they were talking about this thing called Pasang, and this was to do with the launch of the Masters in Global Mental Health, which actually works closely with King's College Institute of Psychiatry. It's a difficult and upsetting practice for some. So if you want to have a look into that, it's spelled Pasung. You can look into why this situation is occurring in Indonesia. It actually occurs in other countries as well, but this is the name they give it over in that country. Now the country in Indonesia is only around about, I think it's 800 psychiatrists and 48, probably maybe less, 48 mental health hospitals. There, unfortunately, has been a continued lack of funding for mental health services in Indonesia. I don't know the actual budget they put upon that. So last one to mention on Indonesia is that another big challenge for that country is that there are no psychiatrists in the actually rural areas of Indonesia, which explains why this practice is taking place. But I do believe there's a lot of NGOs, basically independent, charitable government organizations that will try to help with mental health policies and basically other things, research as well in these countries. Half of them are concentrated, going back to the actual psychiatrists, half of them are concentrated in the capital city, Jakarta. So, okay, the next country on this list, now we've got to apologize, this video is quite long, but there's no other way around it. You know, I'd always like to say, if you can't play it in one go, obviously come back again and listen to or watch this video again in parts. Next one on the list is Brazil. Population around over 200 million. The ranking on the suicide list is, again, fairly low, 136, 35. They have a high rate of psychiatrists, I think over 6,000, compared to Indonesia anyway. They have, I think, 19,000 psychologists, social workers, around 2,000, 3,000 nurses, 3,500 occupational therapists working in what you call a unified health system. And the country has opted for innovative services and programs in expansion of psychological community centres in return to obviously combat the institutionalization of long-stay patients. Remember, this is the push for every country. And their focus, basically, for doing this as well, is to close the old insane asylums with dehumanizing treatment of many of the practices of basic human rights violations. First, I want to look at developing prevention, and also increasing early detection and a range of effective treatments for mental health disorders and alcohol and drug abuse and dependence. Unfortunately, though, there is some belief within Brazil that the outpatient clinics are not really that good. But they still are trying to work within that medical model, and I can only think that is, it's a good thing, rather than going back to institutionalization of mental health patients. Next country on the list is Pakistan, population of around about 200 million. Ranking on the World Health Organization suicide list is, I think it's 179. Bad news, a lot of challenges for Pakistan. Even though the ranking on the suicide list is very low, the stigma against mental health is rampant. It's very high, and it's sustained, I suppose, by popular belief in the spiritual cure. Not that it's always a bad thing, but when it's the only thing, then you're gonna find yourself a major challenge. Now, I think mental health illness affects around 10 to 16% of that population. Only 2.4% of Pakistan's expenditure, something I could found, actually goes towards health, and out of that, and this is really bad, a mere 2% is set aside for mental health. Pakistan has one of the lowest mental illness patient to doctor ratios in the world. A massive challenge. I think they've only, compared to Brazil's 6,000 psychiatrists, Pakistan probably only has around about 400. And also, as a direct result to inaccessibility to mental health care, patients, as I said, will approach faith healers. Another massive challenge is that students are often discouraged from specializing in psychiatry because of other medical fields. It's not seen as prestigious. And even if they did go into it, it's not really that well compensated. So you can see there are a lot of challenges for Pakistan, even though the suicide list seems to be so low. Okay, so the next one is first country, I suppose, in Africa. This is Nigeria, getting around about 200 million in population. Bad news to start off with is the suicide ranking is fairly high. It's 30. And I'm sure there's quite a few reasons for that. Professional psychiatric care is almost inaccessible for Nigerians with psychosis. Again, we're looking at a situation where a large proportion will approach faith healers. Now, if you think the situation with Pakistan about the number of psychiatrists is bad, Nigeria has 200 compared to 400 compared to 6,000 in Brazil. And this is for a country, again, with a population of nearly 200 million. So, again, we're also looking at how much does Nigeria spend on the budget to mental health. It's 3%. Then another problem is that the stigma of mental health is very high, but there's a lot of foreign aid, working to enhance Nigeria's mental health policies. But I've got to point out, there's no point having a lot of these policies if there isn't resources to push these policies if the budget is so low. Even if you did manage to access mental health treatment, if you're a Nigerian citizen, the treatment is very expensive. However, again, we go back to the mental health bill of Nigeria. I think it was in 2013. There is some encouragement. The paper recommends that. Well, what paper doesn't? But the paper recommends that the Nigerian government should create more inpatient mental health units and also outpatient clinics to also be integrated into the general hospitals. Next one on this list is Bangladesh, 162 million in the population, and the ranking on the World Health Organization suicide list is around about 130, 36, 35. There's also other rankings regarding, it's not just suicide, but there's other rankings. I couldn't get hold of it in time, but there's rankings on mental health systems, but I think this is from The Economist over in Europe. So there are other rankings, not just on suicide lists. Some more information on Bangladesh. If you ever come across the Royal College of Psychiatry's website, they actually have a report because they did visit that country, and the report is quite good. It's worth a read. They did mention that I think there's one psychiatrist per million over in Bangladesh, with depression and anxiety and neurosis being the most commonly reported mental health problem over there. Again, situation with social stigma regarding mental health disorders in Bangladesh is very strong. The government health departments is still very inefficient. Less than 0.5% spent on mental health in that country. And there's reported that, I think it's around 70% of the adult population is suffering mental health disorders. Now, again, the World Health Organization has pointed out that some of the problems is medical education. There's not enough education regarding mental health over there. And training for medical doctors is also very bad regarding mental health. And it doesn't help that if you have psychiatrists, being trained and about to work in that country, they tend to emigrate out of the country for better prospects. So those are the challenges. I'm sure there's plenty more challenges, but those are the very big challenges for Bangladesh in regards to the mental health system. Next one, I suppose, is Russia. And about 145 million. Suicide list ranking is very high, 17. And it's very alarming for that to be within the top 20. The big problem, I suppose, which compounds the situation is, I suppose, a lot of it is old age beliefs and human rights abuses. Now, I've kept an eye on this. There's been a big push and a massive lot of criticism to try and separate the field of psychiatry in Russia away from political issues. And I did mention a lot of human rights abuses. Say the wrong thing, do the wrong thing. Who knows where you end up, if you get what I mean. Rates of mental health illnesses are high in Russia, and a lot of people in Russia are saying that it's due to the decades of communist rule. They feel it has played its part into this issue. Also, with access to alcohol and addiction as a coping mechanism is compounding an issue that explains the high rate of suicides. The institutionalization model, unfortunately, is still there in Russia. Although services are mostly free of charge, private mental clinics, I think, by law are forbidden. There's also been, as I said, and I'll say it again, the struggle to try and separate Russian psychiatry away from politics. The mental service is a dense network of outpatient facilities, but in the rural areas, this is very difficult to get access to. For Japan, population around 126 million, and when you think of Japan and suicides, you feel like it's always closely related. And I've been watching this. I've always been sort of intrigued as to why such countries as Japan has a high rate of suicide. And there's many reasons. Obviously, the first one that comes to mind is that the attitudes to suicide is not the same as it is in the West. However, with Japan's suicide ranking, it used to be in the top 10. It's now 26. It's moving away from that. It's still high. Why I was intrigued, why is an economic powerhouse ranking so high? But there's a lot of cultural perceptions. There's unfortunately high numbers of psychiatric beds with a long average stay within these hospitals, for all the wrong reasons, I suppose. Psychotherapy isn't even covered by insurance over in Japan, and when you're talking about prices and getting treatment, prices can vary to the extreme. Also, there's cultural beliefs to mental health, but then that's compounded again by strong stigma attached to mental illness. That there seems to be people seem to be discouraged for even seeking mental health help when they need it. I think there's around at least more than 1,000 mental health hospitals over in that country. However, Japan has lagged behind with the deinstitutionalization trend. They still have the highest number of psychiatric beds with long stay. And there has been, there's been a wake-up call. One of the last things I've noticed is that there was a stabbing incident when 19 people died in Sagamihara, which has prompted the government to literally start overhauling the mental health system because of these incidences. Now, with Mexico, this is the next on the list, they have a population of around about 123 million. One of the most, oddly enough, despite the challenges Mexico has, I believe it's been ranked very high. It's one of the most happiest countries to live. Looking at the suicide list, 148, very, very low. But yes, Mexico does have its challenges, just has its problems, does have its issues. But what are the challenges within mental health? Right. Well, out of population of about 100 and over 120 million, there's been reports that at least 15 million suffer with some kind of mental illness or disorder. Mental health in Mexico is recognized as one of the main unresolved issues that, again, government is trying to tackle with its policy agenda. But again, there's a specific word for it. It's called machismo, which, as you can tell by the word machismo, it means that there's a big, strong problem with stigma. So underreporting of depression, people won't seek it. And even if you are seeking help, there has been, again, a lot of media backlash. I'm going to give you another words, abandandos, which is terrible. It means the abandoned ones. Basically, you're talking about patients who are literally locked away inside Mexico's psychiatric institutions. Now, Mexico spends, I think, around about 2.5% of its health budget on mental health. Very, very low, because the recommended spending, I suppose, for, which is what Health Organization recommends, is around about 10%. There's also been, as I said, and you can check up on the internet, absolutely horrific abuses regarding patients in mental health hospitals, overcrowding. They're abandoned in some senses. It's now, when the UN starts getting involved and making a lot of noise about it, they have a big problem. Okay, so the next one on the list is the Philippines. And we're now looking at the population of around about 100 million. Suicide ranking list, 162. Presently, over in that country, is around about 700 psychiatrists and around about 1,000 psychiatric nurses. Half those working in that field work for profit, mostly in private practice. So again, if you're low income, you're going to be deprived on trying to seek help. Low budget on mental health, only 5% is, spent. I think even less is spent on mental health. The mental health facilities and institutions are usually they're maintaining both private and public groups, but access to them remains uneven throughout the country, and this is going to be a problem for quite a few countries on this list. We might have a high number of the facilities, institutions, and resources, but are they distributed evenly? Again, with policies, there's several programs and initiatives that, at least try to pursue strengthening mental health support and lessen stigma against mental illness in the Philippines. Another thing that I want to point out, which is quite, big notice, is that Philippines has a high number of domestic workers who are very vulnerable to abuse and working conditions because of the work by nature. So it's something to take note of regarding who uses the mental health system over there. There's another thing to point out is there hasn't been any increase in the number of beds available. So that's something, again, it's not just for the Philippines, but a challenge a lot of countries that are on the list that need to face. Next one is Ethiopia. Again, about 100 million. I won't spend too long on this one. I think their ranking is around at 44. According to World Health Organizations, all of the countries, or psychiatrists and psychiatric nurses work in the capital. And we also, unfortunately, have, even in the hospitals, people being, physical restraints being overly used because there's a lack of medication. And there's also, there's not really a big push to train a lot of these psychiatrists. Training is still low, although there's still a large number of NGOs, governmental organizations trying to help with policies in that country. Stigma over in Ethiopia, as I said, is quite rampant. Regards to spending on mental health, I don't really know. I would suspect it's very low. The primary sources of mental health financing, I think it's usually tax-based, is out of pocket of the patient or the family. Next country is Vietnam, around about 90 million. Suicide list is very, very low, 126. I think around, out of that population, 90 million, I think 15% usually have various mental health disorders. Now the government's have a figure here, spends around about 2 million USD per year on mental health, compared to other countries, like say in Thailand, they only spend about 46 million, which is, for Vietnam is very low. Both, if you're looking at training, I think both psychiatrists and psychiatric doctors, psychiatric nurses, I think spend around about specializing 3 years to receive their training. But when it comes to research, there's a fair lack of research regarding mental health needs, mental health policies, because there is a barrier, suppose, in stigma. There's the mental health hospitals hold, I'd say, 3 diagnostic groups of patients that usually fall under schizophrenia, schizotypal, and delusional disorders. And they would range from, suppose, within the disorders, 60% is under the delusional disorders, 50% mood disorders, and other forms of disorders like stress-related and somatoform disorders, around about 15%. The ratio for psychiatrists to the population is very low. I think it's 0.3 to 100,000, compared with 11 in the UK and 13, I suppose, in the US. Next one on the list is Egypt. And we're looking at population again over 90 million, ranking in the suicide list around 167. Again, you still got a stigma problem. Mental health remains one of the most darkest taboos in Egyptian society, and shame, embarrassment, and even if you seek help, you're subject to routine scrutiny and abuse from society. You're ostracized, if I could put it that way. Training given to psychiatrists and nurses usually focuses on transmitting experimental medical knowledge to equip doctors to treat patients inside Egypt. I think they have around about 18 mental health hospitals. But then when you look at the budget Egypt spends on the mental health system, it's a meager 2%. And that is usually around about 70% is of that funding, of that 2%, is on psychiatric hospitals. So you can imagine what the ratio is regarding care in the community and other services. Now these hospitals, in total, I suppose the bed capacity is for no more than a couple of thousand, probably 5,000 patients. If you look at the population, around about 70% of Egyptian population is suffering some form of mental health disorder. So we're looking, I suppose, about 13 million people or less. And it's usually, what's reported is, again, depression and anxiety and schizophrenia and substance abuse. But as I said, the ratio is low regarding a psychiatrist, so it's almost about 1 per 100,000 people. Now coming to Germany, this is where things take a turn. I'm not saying they don't have any mental health system challenges, they do, but they come top, what I found, of the mental health mental health integration index. The ranking regarding suicides is 105. Not to say that it's 105 people committing suicide, but that's the ranking overall. I have a strong healthcare system, a very generous social welfare program, which has been helped with a better integration. They've been very successful in deinstitutionalization. Germany spends a whopping, as I said, 11 to 13% on its healthcare. which means it spends on mental health is around about 2.6 billion a year. Now, psychotherapy and most prescription drugs are covered by national insurance. I think it's mandatory over there to have national insurance to cover social care costs. And with those costs, you're allowed to see a therapist or a psychiatrist, I think up to 5 times before you decide to have therapy with them. It's also strong training regarding Germany's many psychologists in the fields of psychology and social psychology, biological psychology, neuroscience, personality studies. So they have the research. They spent a lot of time polishing the mental system, but there still are challenges. Next on our list is Democratic Republic of Congo, 80 million on the population, mid-ranking. Well, it's actually, I'd lie, I think it's very high. Suicide ranking list is, I think it's around 58. There is no way I can find the budget allocations for the Democratic Republic of Congo. So I don't know if there's even much of expenditure on the mental health system. High rate of NGOs, which means these foreign governmental organizations mainly trying to be involved in advocacy, promotion, prevention, and rehabilitation in mental health over in the Congo. I think over in that country they have only around about 6 mental health hospitals with probably around about 500 beds each. Psychology over in that country is not that well known. It's not even accepted as a discipline in many of their universities. So there's a lot of challenges for that country regarding the mental health system. But do remember, it's not, although I say there's a lot of challenges, there's also, you've got to remember that you've got to understand the histories of these countries, which I can't really go into because the video would just be overly long. Again, some of these countries have gone through like a lot of war-torn trauma. You've also got natural disasters, which makes other resources be diverted. And then I suppose you've got some countries just don't have the governmental strong backing. So, please take note of that. Okay, the next on this is Turkey, population of 80 million, ranking on the suicide list 110. Again, with the Department of Health, it doesn't really authorize primary care nurses to prescribe or work on prescription. But they have a total of about 360 psychiatrists that serve around about 6,000 beds in the 5 psychiatric hospitals in the country. Comparison, I wouldn't say it's good, to be honest, because you could say the comparison of a mental health unit per probably around about 170,000 people in Turkey, whereas in the States, I'm going to do a comparison. Their comparison is 1 mental health unit per 60,000. There's been again a media backlash regarding Turkey's mental health system. In fact, things got so bad, I don't know the name of it, I think it's the APA committee, wants the Turkish Psychiatric Association to literally clarify allegations of human rights abuses in Turkey's psychiatric facilities. And one of the challenges, I'm sure there's more, but one of the big challenges is the economic difficulties and the lack of regulations that are actually enforced on the mental health system. One good thing actually to note is that psychology is actually very popular over in Turkey. So it's one of the major disciplines over in their universities, and it's highly sought after. Over in Thailand, we're now looking at a population of 70 million. Ranking regarding suicide is still quite high. I think they're ranked 46. Mental health expenditure, that being the budget spent on the mental health system, is just 4%. But as far as I know, there's at least 3 million Thais who suffer from some form of mental illness. They have around about, I think, 17 psychiatric hospitals around in that country, but I suppose many of the homeless, especially in Bangkok, suffer from schizophrenia, and it seems to be the most common mental health disorder in Thailand. There's an average of, I think, around about 7.3 mental health workers, comprising of nurses, psychiatrists, administrative staff, for every 100,000 of that population. With, and this is fairly good, I've said about 120 outpatient facilities nationwide, usually located in general hospitals, and out there 17 mental health hospitals. Unfortunately, I don't know if this is good or bad, but I think it's pretty bad, but Thailand has no day treatment facilities. And a lot of these clinics are, where they're not easy to reach. With stigma, I'm not sure why, certainly if we looked into it at another point, people in Thailand seem to repress their feelings of mental illness, but it tends to happen far more in the remote areas. People just do not understand mental health condition, and this points to, again, education as one of the key factors in trying to challenge a high rate and rise in mental health problems. Next one, let's take a look at France. Population around 60, 70 million. Ranking on the suicide list is around 50. They spent about, it's quite high actually, 12% on the mental health budget. In fact, France ranks on another list I've noticed, which has come from The Economist, the Intelligence Unit's mental health list. They rank 13. Now they have, it's a high number, at least around 13,000 registered psychiatrists. But the problem with this, and remember, this is the highest in the world now, but the problem with this is that French psychiatry, there's no, they can set up in densely populated areas. So, all right, you have a high rate. I mentioned this earlier in the video. You have a high rate of psychiatrists, but it seems to be high rate in one area and then next to nothing in another area in France. The way they divide up these areas is that they use, I think it's around about 850 psychiatric sectors. Each area usually serves a population of 70,000 people, and it's usually centered around a hospital unit. With regards to the French healthcare system, it only covers being treated by a psychiatrist and not a psychologist, which means access to therapy is a lot harder. And therapy is very important, hence the occupational therapist. Just because it might not seem so prestigious, it's very important. So because of that, you're looking at what's mentioned, that is 85% of psychotropic drugs sold in France are prescribed by general practitioners. That means by doctors, basically. One big problem, well, there's several, but one of the biggest problems I've noticed in France mental health system is that, again, the hospitals are confounded with a problem in finding beds. This is something that is, also for the UK, also for a lot of other countries. And also the problem is a lot of the systems, a lot of the psychiatric hospitals were built during the 19th century. So again, not just the lack of beds, but the amount of money they got to spend on building up these systems. So okay, now to my country, the UK. Population around about 65 million, 70 million. Ranking on the suicide list has improved. I remember at some point it was probably about 60 something. It's now 123. Or the lower the ranking, the better. So if you're in the top 10, you have a high rate of suicides in your country. So something's working. And another good news for actually the UK, a lot of people may not think so because there's a lot of criticisms, and rightly so, on our health system in the NHS. But we were also ranked as second amongst Germany regarding mental health. So our healthcare is free due to NHS. It offers free counselling, free therapy, treatment. But the problem is the waiting list. So you can sometimes be waiting very long. In some areas, is what you call a postcode lottery. Mental illness, I suppose, in the UK is one of the largest single cause of disability, account for at least, when you look at NHS, 23% of activity is due to treating mental health illness, but only, I suppose, 6% actually goes into research, which is something a lot of the mental health organizations and the Royal College of Psychiatrists, the British body of psychiatrists has been saying there needs to be more research. And also, as I mentioned, the Royal College of Psychiatrists, they did highlight some fundamental failures regarding health service, like the rise in patient suicides, the long waiting lists, lack of beds for those who are very unwell. And another thing I want to add is that it takes so long for them to help someone in a crisis. You have to be that unwell to get that help, which sometimes means it's almost too late. And several more things I want to mention. I've heard this term time and time again. They feel that mental health within the NHS is almost a second-class service. They call it the Cinderella service regarding the National Health Service. And I suppose it's due to how much budget is spent on the mental health service. They receive, I think, only about 13%. I'm not too sure. Despite mental illness affecting around a quarter of the population, compounded with further budget cuts. So the future doesn't seem very pretty. There's been very strong policies, though. But again, if the resources aren't there, if the financing isn't there, you can have the strongest policies in the world. It's not going to make so much difference. However, the government has suggested that they will increase their funding to around about 300 million by 2020. Next on the list, I suppose, Italy. Population around 16 million. Suicide ranking list very low, 143. And we spend around about 5% on regarding the budget on the mental health system. They have a nationwide network of departments within mental health that deliver outpatient and inpatient care, but also run semi-residential and residential facilities. Usually around, we're talking about 2.8 beds per 10,000 of the population. Mental health care in Italy is delivered by mental health departments. That's what you call MHDs over there, that are in charge of management and planning of all medical and social activities. Now, as far as I know, there are not that many mental hospitals in Italy. Most of them are what you call services that are delivered within what you call daycare centers to avoid the institutionalization. Remember, as I said, and I'll say again, there's a push for every country to avoid institutionalizing those within mental health hospitals or asylums. Next on the list, we're going back to Africa. Two countries I want to pick out, Tanzania and the next one, South Africa. Tanzania first, population of around about 55 to 57 million, suicide ranking. This is really strange because I remember at some point Tanzania was actually first, or at least within the top 5 regarding the suicide ranking list. I'm not sure what's happened, but it's still quite a serious problem over there. they do have a mental health policy. I know was released, I think it was formulated in 1990. The country spends around 7% on its health budget on mental health. But the resources for financing mental health is usually taxed, and it's from grants as far as I could find out. Usually mental health is, again, part of this health system. The actual treatment for severe mental health disorders is available at primary level, but most patients in Tanzania are usually seen at primary care facilities, health centers, and unfortunately, traditional healing practices. Psychiatric rehabilitation villages, I think there's around 6 over there, can accommodate between, I suppose, 80 to 100 patients at any given time within that country. And they provide sheltered living conditions for homeless psychiatric patients, continued treatment, and training facilities. Remember, there's probably a high number of NGOs, again, advocating, helping in rehabilitation, and pushing for stronger policies, or at least doing research out there. And in South Africa, with a population of 55 million, their ranking on the suicide list is 74. It's not a good state over there. It's really bad regarding the mental health system. A huge number of media backlash with the I think it was a minister resigning because, and this is something that, I used to be a governor at my local mental health trust, and I advise other governors to do the same. What problem they had over there with this minister having to resign is that they had pushed for a business model to reallocate mental health patients because they felt they could do this on the cheap, which led to 100 mental health patients dying because the resources was not there. So it's something I would remind anyone who's helping to govern, major mental health hospitals, just to keep an eye on whether something's pushed, especially with these STPs now over in the UK, where they're putting profit before quality. And although a lot of people around say, no, we'll never do that, it can easily descend into it because of the amount of pressure from other organizations to say you've got to save costs before the quality of the healthcare. Now, so I've diverted a bit. I've got to go back to system in South Africa. But yes, I've looked around, and every time I keep seeing this report on how these patients died was actually horrific. We're talking about, pneumonia, dehydration, diarrhea, all sort of these things you wouldn't want to pick up in hospital. You go to hospital if you've got these things. You wouldn't pick them up. Mental illness is very prevalent in South Africa, but the problem is that they lack the necessary resources and the policies needed to execute an effective mental health system. And then you've got the African traditional medicine, which, still plays a huge role in African society now. All right, it's cultural beliefs, but when it's the only thing that the population seems to think that will help, you do have a problem. Now, the quality of the mental health care actually varies greatly from district to district within South Africa. We're talking about postcode lottery again. So I think they have their 4 provinces. So we've got 81 to 100% of available resources in 4 provinces. I suppose in another province is only 20 to 15, and another province is literally 0. So again, they need to try and distribute the resources evenly. No point having a high rate of mental resources in one area and people can't get access to it. The number of treatment, and this is coming from another report, I think going back in 2009, so I'm afraid it's quite old. but they found about there was about 16.5 people of that population were suffering mental health disorders, but only 25% had treatment. So there's a lot of work for South Africa to do. It's a really big shame. I'm sure there's some good things going on over there. Maybe one day I'll find out, but this incident is fairly recent. So, but anyway, Myanmar, the black country population is 53 million, fairly low ranking in World Health Organization suicide ranking, 153. Very low on its budget for mental health. They only spend 2% on that. I suppose they've launched a mental health strategy to try and deal with this population with the assistance of the World Health Organization, but the cultural stigma in Myanmar is very high. There's a lack of public understanding about common disorders and about depression and anxiety, which really compounds the issues. And within the mental health facilities, they've got a serious overcrowding problem, seriously understaffed. The ratio, I believe, is about 25 doctors to over 2,000 patients. And each facility is only attended to probably maximum house, probably about 800. So it's really low. Okay, so South Korea. This is something, again, regarding Japan. I was intrigued, why on earth is South Korea so high in the world ranking suicide list, right? They have a population of 50 million. The ranking as of current of this video is 10. But I do remember seeing the ranking as almost as high as 3 or 7. Actually, I think China was 7, so it must have been 3. Last year, I think. The suicide rate in South Korea is nothing short of alarming. 3 times higher than in a comparison to the United States. Ferocious pressures put on the population. And I'm talking about academic pressures. Pressures not only after the prestigious universities, if you manage to get in, but also trying to find work, stay in that work. Pressures all around. I'm sure there's cultural beliefs regarding suicide. I'm sure that is the case as well. It's the only developed countries that saw an increase in the number of psychiatric beds, with the longest average length of stay of psychiatric patients, for part of the decade. It showed a 340% increase in psychiatric bed rate, which is astounding. They have, regarding payment in medical aid, the problem is there's zero co-payment, which means that you can have patients staying in these wards, unnecessary. I think within voluntary psychiatric admissions, they account for about 80% of all psychiatric admissions in South Korea. And the only, the problem with the mental health system in that country is, again, it's the only developmental country that is going against the trend of deinstitutionalization, which again, it goes against the best interests of the patient. So I'm just not sure, what could be done. It's been like this for some time. But again, it's a challenge. It's something that they have to work in order to change things for those using mental health services. It's got to be education. Someone's got to give. Basically, that's what I'm saying. Kenya, back to Africa, population of 50 million. Ranking on the suicide list for World Health Organization is 84. Population, basically, is a very young population. The majority of people are actually below the age of 30, just out of interest. And unfortunately, there's a lot of myths about what causes mental illness over there. From my search, a lot of it is concerning witchcraft. There's just one particular person that I've found it on social media. Her name is Sitwa Wafula, She's a mental health crusader over in that country, desperately trying to break mental health stigma. I will do a video one day on mental health champions in these countries, literally trying to challenge the stigma. I advise you at some point to look them up, but remember this name, Sitawa Wafula, desperately trying to break the stigma. Again, if you look at Kenya, overcrowded facilities in the capital, Nairobi, hard to reach for those who live outside that capital. Mental health care in Kenya is, again, it's government funded, but is extremely limited in infrastructure, manpower, and finances. In regards to psychiatrists, around about 80 per year. There are actually 500 trained psychiatric nurses over in Kenya. 250 are employed within this form of psychiatry, while 70 are in other hospitals. But the problem is the others are leaving to other districts and provinces, so they're trying to, again, spread them evenly. Last one is a very long video. With a population of 46 million and a ranking on the suicide list as 135, around about, I'd say, out of that population, 9% of that population suffer with probably at least one mental health disorder. Now, people usually actually go to a private therapist over in Spain because they find it a lot easier. They normally tend to get that recommendation from a family member or friend. So I'm not sure if they have something like NHS Choices over there, which I'm sure they do, which helps in recommendation. They spend on the budget. They spend around about 5.5 compared to the UK or Germany. They're spending allocating 13%, 13 to 11%. So it's fairly low. The current strategy really is to reduce the mortality rates associated with mental health illnesses. So they've got some comparative esteem. Hence, they know full well that physical and mental illness, those suffering mental illness can obviously suffer physical illness. They're both the same thing. Suffering physical illness can affect your mental health. Likewise, so they're pushing to reduce the mortality rates. If you go and see a doctor over there, you're covered by insurance and they can refer you. But again, there's a lot of challenges over in Spain. What's made it difficult for them is that there's a huge economic problem over in Spain. Obviously, if you've got something like that, it's going to hit your mental health budget. It's going to hit your mental health system. But to conclude, the reason why I've done this. So to conclude, the reason why I've done this is that for each country on this list, what I've noticed is that the task and challenge for each country is that they must, and this is up to 5, they must obtain better data regarding the use of those using the mental health system, so that way they know to target on who needs support. See, without obtaining better data, it's impossible to understand whether your mental health policy is having any impact. And they also need to improve research. Another task, I suppose, for each of this country that I've mentioned on the list is provide funding. As I've mentioned before, there's a lack of funding, there's a lack of budgets. You're talking about 0.5 all the way to 11% on mental health. There needs to be the political will to invest, which is probably why there's a lack of funding, a lack of budget put aside into the mental health system. Obviously, the institutionalization needs to be pursued, needs to be finished. Again, countries going backwards, thinking that perhaps we can sweep this under the carpet, put mental health patients in the hospital, lock them away, and that make the problems go away. No, it doesn't. So there needs to be deinstitutionalization amongst all of the countries, so that way they have a better human rights record. And that's not the only reason, but that's one of the reasons. And if you're going to move away from that model, they have to also have these community-based services set up. And don't just feel like, you shut down all these institutions, these mental health asylums, only to place patients in a community-based model in community care, and the resources are not there in the first place, because all you're going to really do is put pressure on families and carers or caregivers and other organizations that are not resourced to cope. And another thing, I suppose, is, and this is quite important, although it's mentioned last, when you're looking at recovery, you want to look at employment. How can they make employment for those suffering mental illness? And one of the key factors, not to the point where you're going to force someone to work because the government wants to tax people and get as much money as they can. What you want is to make employment a major factor in someone's life, because it is a big part of, whether you're ill or not, it's a big part of someone's life. What they want to do, how they want to work. So it's something that needs to be tackled. But I'd like to thank those who took the time to watch this long video. I'm going to cut it short here, and I will want to continue on from, perhaps in the future, a few other countries regarding the mental health system. So thank you again, and I hope to see you next time.